Hi, everyone. My name is Dr. Rachel Bussman, and I'm a clinical psychologist at the Childmind Institute. We're a national nonprofit that supports children and families with gold standard mental health care advice and resources, all online and accessible to everyone. We're here for you wherever you are with expert telehealth resources, including diagnosis and treatment of mental health and learning disorders, group programs for anxiety, mood disorders, ADHD, and more, remote neuropsychological evaluations. Please visit childmind.org/telehealth to learn more. With protests over the violent death of Black Americans dominating the news, it's understandable that many children are feeling scared, confused, or angry about the situation, and you may be too. We're all thinking about racism and violence and how to raise caring children and talk to them about what's happening in our society. We're happy to answer your questions about whatever parenting challenges you have and the anxieties that you may be facing yourselves. Today, we're going to talk about navigating reopening and what that means. I just want to remind everyone, if it's your first time tuning in, you can type your questions now or at any point during the broadcast. We're keeping track of them so that we can get to them if we don't get to them today, but feel free to type in now and we'll answer them as I can. I also will thank you guys in advance for sending some questions so that we can start now. So the first question is, what is reopening going to look like? And I think that that's a really natural question. And unfortunately, I'm going to have to answer that question with a little bit of uncertainty because it just looks so different no matter where you are. So really, depending on what state and even within a state, what county or town you live in, your reopening is looking different. A lot of folks are in phase 1 or phase 2 of some kind of reopening, which means that maybe restaurants are opening or some programs and there are some loosened restrictions or some new guidelines. And so I think to answer the question of what will it look like, the answer is we don't know what it will look like because it's ever evolving. But one of the ways that you can stay on top of information and balance feeling overwhelmed is to look to reputable sources of information. So we look to the CDC. I, in my town, look for town bulletins that come to me. I get alerts, but I don't go every day on the website to find out new information. I do get some information about county-wide information. And I think that looking maybe once a day or even less frequently is helpful because otherwise we can really get saturated with an overwhelming amount of information. So one question is, my son is still very afraid of getting sick. How can we help him manage his anxiety as we reopen? So I think that's a really relevant question, and it's not so surprising, right? This person's son is still afraid of getting sick, and maybe you yourself are feeling that as well. And so I think the first thing just goes back to really good tips around validation, right? So sometimes when our children express a worry or a fear or upset, our inclination is to try to make that feeling go away or help them feel better by saying something like, you don't need to worry about that, or there's nothing to really be afraid of. And while that makes sense why we want to make kids feel better, it does something called invalidating their experience. It kind of lets them know sometimes that you can't handle those emotions or that there's something that is not allowed, right, in some way. And it's not an intentional thing. Of course, when my son's upset, I want to make him feel better immediately. But the first thing you can say is something like, I know that you're afraid. Or sometimes just repeating what your child says is actually kind of validating just like that. So saying, you're feeling really sick, you're scared about getting sick. So just repeating what they say, I understand. Let's talk about that. Right? Because in your mind, you might be thinking they're worried about getting COVID, right? And that's probably not an illogical leap, but they might be worried about something specific that if you don't invite more conversation, then you won't actually know what they're worried about. So they might tell you that they're worried about getting sick because they're worried about their grandparents getting ill versus they're actually worried about themselves getting sick. Or so it's really important to lean in a little bit and say, I totally hear you. You're worried about getting sick. That's really important to me. I don't want that to happen. Let's talk about that. And then answer some of their questions. because that's a really nice opportunity to dispel any myths, correct any misinformation, and then remind them what you and they are doing to stay safe and what rules and sort of regulations you're going to follow. Now, that's different from if your child says, I'm really afraid of getting sick and I actually don't plan on leaving the house until there's a vaccine. You might say something like, well, that sounds like you're really scared and we really need to talk about it because actually the plan is, and then insert whatever your plan is, because we want kids and adults to get comfortable doing things that are challenges and within the realm of what is reasonable risk. So it's a tricky one. And if you have questions about that, let's pop them up on the chat so we can talk about them. So another question that I think is really important is, how do we know when it's okay to do things? Not everyone is following the rules. Everyone seems to say something different. And I think that's really true, right? And so we don't know when it's, quote, okay to do something, right? Because every place is very different, right? As I said, states are different, towns are different, city versus rural, all those kinds of things. So you want to get, again, reputable information. So again, I get town information for my county that I live in that also sort of breaks down some data. Data is helpful because it's factual rather than myth-based. So that can be helpful. I also think you have to know what you feel comfortable with in your family, right? So what I and my family does and the rules we practice might be different than a different family that, let's say, has an immunocompromised person living in their home, or has a certain thing they need to do around childcare or travel or any of those things. So everybody is a little bit different. And so it's helpful to remember that when you're looking at what other people are doing, to reserve judgment. On the other hand, it is really hard, and I have had this conversation recently, where not everybody is following the rules, and what you feel comfortable with, or what, let's say, is posted on a business that says wear masks, and you see people not wearing masks, that might be frustrating to you as an adult. It's confusing for your children. And then you have to kind of make a decision about what kind of action you want to take, right? So I really believe in having your actions follow from what is important to you, right? So I cannot control what other people do. I can control what I do. And I can say what things are important to me, and I can also live by those values, right? So if it's important to me to go to the grocery store for any reason, I need food, I can't get deliveries, and I know that I'm supposed to go at a certain time and wear a mask, I'm going to do that. And then if I see people not following the rules, I have some choices. And some of those choices, and they involve a lot of different things. It might involve, if my child says something like, why are those people not following the rules? Saying, you know what, Jackson, you notice that they're not following the rules, and you're right to notice that. But we're going to do this. We're going to wear masks. We're going to wear gloves if we wear gloves, or we're going to be socially distancing, etc. Similarly, you might decide that, let's say you're at a store or a place and you really want to patronize that store and you value having a conversation with the manager. You could do that. You could take action. You could say, I'd love to chat with the manager and say, I don't want to be a stickler. And at the same time, like, this isn't really about like picking up the eggs and handling them or opening a container of something and tasting it and putting it back. This is about safety. You have some rules about social distancing or masks, and I don't see people following that. What are you going to do about that? If the person might actually thank you and say, I don't have eyes and ears everywhere, so I'm really glad that you told me that, and I'm going to take care of that. Or they might say, you know what, miss or ma'am or whoever, sorry, I can't enforce that. And then you have a decision as a parent or a caregiver or an adult to choose to shop somewhere else or choose to go somewhere else with your family. But I do think that it's helpful to remember that you can take action by being aligned with what's important to you. You might actually also choose to have a conversation with another customer or another person in a town. I think that takes a lot of bravery. And sometimes that fight might not be something that you have the bandwidth to do. And I can't say for sure if that's something that's going to be fruitful or not. I just think you want to know, observe your safety and know your risks. And it might just not be worth it to say to someone, you know what, I notice you're not doing this. You really need to do that. So that's what I'll say about that. So as a reminder, if you're just tuning in, we're talking about navigating reopening. And you can type any of your questions now in the little chat panel and we will answer them. Another question is, I know this sounds insane, but I really love the family togetherness that's happening during this pandemic. No one rushing off to jobs or school and everyone kind of coming together. I kind of am going to miss this. Is there a way to keep that as we navigate reopening? So what I'll actually say is I don't think that that's insane at all. I think that's a really reasonable and valid thought. And whoever said that, I think is also really brave to say that. And I'll admit that it is really nice to see my son every morning and be able to put him to bed every night. So I will just say that very honestly. I also miss going to my office, but I really love being able to see him every day. So that's really nice and lovely. And I really love being able to see my husband every morning and all those kinds of things. And no one says that those actually have to go away. So I actually think the important part is the intentionality, right? And so if there's something that you like, the silver lining, if you will, then there's a way to set a goal, I think, that's intentional and meaningful, but is achievable, right? So much like if you're setting a goal to go to the gym and you've never gone to the gym, or to run and you've never done that, if you say, I'm going to run every day 3 miles, that goal is probably, I mean, maybe you're someone who can do that, and I applaud you if you can. And at the same time, it might easily lead to feelings of shortcoming, because if you don't go to the gym or you don't go out and run 3 miles, you might be like, well, that was too hard. Versus if a person, like the person who identified this question, could say what they really enjoyed. Like, I enjoyed that we played a game a couple times a week as a family, or I enjoyed that we read a book together, or I actually enjoyed that I had some Zoom calls with family I haven't talked to in years. Then say, I'm going to keep doing that. And I'm going to do that. I think the more specific we can get, the better it is. So maybe you say, I would like to have family game night once a week, or I would like to take walks twice a week, or I'm going to Zoom with Aunt Susie and Uncle, Harry in California once a month. And in fact, let's put it in our calendar now and have an email with those aunts and uncles and cousins and hold ourselves accountable to that. And so I think that that's very valid and reasonable, and no reason to feel bad about saying I would miss some of those pieces. And I think you could also engage your children in a conversation and say, I don't know about you, but I've been really enjoying X. And like in my family, we rarely watch TV together during the week at night, but we've started to do that. And we happen to be watching a show that I think is really fun for families called A Series of Unfortunate Events. And so Lemony Snicket, it's really kind of funny and I enjoy it. And so maybe I'll continue to say, you know what, we should have a show or a series that we watch as a family because it's kind of fun. And actually, this is just me sharing this, that we have one couch that's big and one that's small. So my husband and I take turns with who sits on the small couch with our son, because that's where he likes to sit. And it's kind of a nice little tradition. And it doesn't have to be around screen time. It can be around reading. It could be around playing outside, any of those things. But I think those are really nice moments that you wouldn't want to lose. People have told me a lot that they've been cooking and enjoying cooking, or cooking with extended family, or taking turns. And again, that's something that can be kept as a new routine or a new ritual, infrequently or often. Okay, so let's see another question. So another question is, how do I have tips for managing my own anxiety during the reopening? So I think this is a good question. We've talked a little bit about if your children is feeling uncomfortable or worried about getting sick. And I think the natural feeling is that you as a caregiver might have some anxiety about going back to work, about your partner going back to work or a loved one going back to work. You might have anxiety about, should I send my child to camp or not? There's lots of different things that you could feel anxious about. And again, really the same strategies we use for kids are really helpful. So you could validate your own feelings, which is hard sometimes, but really even just saying things like, I'm having a feeling of anxiety and it's a really valid feeling. And I know I call my sister a lot, or I ask my spouse, like, I'm having a feeling and I'd really like for you to reality test that. Like, is there something that, do you think I'm being reasonable? Are you worried about that too? Or maybe I'm able to say, I actually think I'm not being super reasonable, but I need some help with this. Can you help me problem solve how to navigate this, right? And then again, like knowing that you might feel anxious about something or have a comfort level with something that someone else just has a different set of comfort with. And that is okay. So for example, some day camps are opening and some people are sending their kids to day camps. And I actually feel like that's fine for some people to make that. And I'm not making that decision for my child. And if I start to feel anxious about, I wonder if people think I'm being like a bad parent for not doing that, or I'm wondering if other people think I'm being really neurotic for not doing that. I'm actually just okay with saying to myself, I'm having a little bit of anxiety about what other people are thinking. I'm sure plenty of people have thoughts about what I'm doing and saying, and that's just the case. And I feel really comfortable with my parenting decisions right now. And even if I don't, I'm going to pretend like I do because I need to kind of stay focused right now. And that's what I'm going to do. And what my spouse and I have decided is what's good for us. And that's what we're doing. And so I think reminding yourself that, and that can be really hard if, for example, and this is not my particular situation, but let's say you as a parent have made some decisions with your partner or caregiver or yourself, and a different person in your family is doing something different. So maybe your in-laws or your parents think that you should be sending your child to camp when you don't want to be, or vice versa. You need to engage in a child care program because you're working and you've made that decision and you understand the safety risks and you know them and you don't need to be reminded because you've already thought about it. Knowing I might be doing something that other people in my family aren't doing. And you know what? I've made it this far to be 25 or 35 or 45. And sometimes other people in my family are not going to love the decisions I've made, but I am okay with that. And I think you can practice saying, let's say a family member, hopefully well-intentioned, says, I think you're being ridiculous about this, or I don't like your decision. You could just say, thanks for your feedback. I think it's helpful to say that even if you're not. But you could say, thanks for your input. I've definitely given this a lot of thought. And so I'm seeing a comment that's coming in. I'm not quite sure exactly, so I'm going to answer it the best I can. And I think that if someone's feeling is based on some thoughts or a sequence of sort of thoughts, it can definitely be helpful to say, let's talk about that. So I'm not sure if this is getting to what the person says, but let's say your in-laws or someone says, I really think you should do X, Y, or Z. And you could say, all right, like, I really appreciate your input. I can't promise you that at the end of this conversation, I'm going to change my mind, but I'd love to hear what you have to say. Or can I send you, I saw an article that I think you should read. Yeah, sure. I'd love for you to send that to me. That sounds great. And maybe understanding someone else's perspective. I don't think that having a conversation means you have to agree with the other person and decide to make that decision for your own child. And again, like every child is different, right? So some folks have said to me, like, your son must be so lonely. He's an only child. Isn't he lonely? And I don't take that offensively. Like, I'm sure the person is thinking, they're just thinking about my son. But you know what? He actually loves playing by himself. So he's like perfectly happy to do Legos. And maybe another kid feels very lonely. And both those feelings or experiences are valid. It doesn't mean that my son's experience is wrong or that Johnny, who lives next door, is wrong for really missing karate. It just kind of highlights that the human experience really has a huge like kind of curve, and really just kind of gets to the fact that everybody has different experiences. So I really appreciate, I like the wave. So thank you to the wave. And I really appreciate the questions. I really think that there's a lot here. And I think we'll be continuing to have these conversations over the coming weeks and months, because what will it look like? That was the first question about reopening. We're doing it. We're doing it now, and we're going to keep doing it, and it's going to change. The landscape is going to change. And so please keep asking your questions. And I just want to thank you all for joining me today. I hope it was helpful. Remember, we're here every day to support you in this extraordinary time. The Childline Institute is here to help with the mental health and parenting needs during this crisis, no matter where you are. Please visit us at childmind.org/telehealth to learn more about the services we're providing during this time for children, teens, and young adults. Be safe, and thank you.